Imagine getting burned and needing an exact amount of medicine to heal quickly and safely. Doctors don't just guess. There's an actual math involved in medicine. Hi, I'm Dr. BRIONES, and today I'll show you how simple piecewise function helps determine the dosage of neosporin cream for burn patients based on their BSA or body surface area. So here's how it works. If the burn affects 10% or less of the body, the dosage will be 1 gram of cream per 1% BSA. And if the burn affects more than 10% of the body, the dosage will be 0.8 grams of cream per 1% BSA. We can write this as a piecewise function of y is equals to 1.0x if x is greater than 0 but less than or equal to 10. And also, y is equals to 0.8x if x is greater than 10. Here, x is the percentage of the body burn and y is the dosage in grams. Now, here's a scenario. Bella's burn cover 18% of her body. So, we can use 0.8x. And the mathematical model will be y is equals to 0.8 times 18, and that will equate to 14.4 grams of cream. Meanwhile, for Jeremiah's burns cover 5% of his body. So, we use 1.0x. And the mathematical model will be y is equals to 1.0 times 5, and that will equate to 5 grams of cream. So, Bella needs 14.4 grams, while Jeremiah needs 5 grams of neosporin cream. According to Flint et al. 2025, BSA or body surface area is essential in pharmacology, especially when determining dosages for chemotherapy and certain antibiotics. In dermatology, using piecewise function is helpful because it helps the doctors to quickly calculate safe and effective dosages based on the patient's BSA, minimizing risks and ensuring proper treatment.
Have you ever wondered how cardiologists keep track of their patient's cardiovascular health? Then here's the situation. A cardiologist is monitoring his patient's heart rate. Let's name the patient Miguel. Now, Miguel was using the treadmill at a speed of 4 kilometers per hour. Afterwards, the cardiologist identified Miguel's heart rate to be 85 beats per minute. Based on a prior study by Zhang et al. 2016, heart rate increases by 7.5 beats per minute for each kilometer per hour increase in speed. With this, the cardiologist ought to answer these questions. Firstly, what is his heart rate if the speed increases to 6 kilometers per hour? Next is, what is the heart rate if the speed increases to 8 kilometers per hour? And lastly, what is his heart rate if the speed increases to 10 kilometers per hour? To solve, Miguel's heart rate of 85 beats per minute is equated to the product of the constant beats per minute of 7.5 and the initial speed of the treadmill, which is 4. Added by initial heart rate of Miguel, denoted by B, which will have an equation of 85 is equal to 7.5 times 4 plus B. After solving, the value of B will then be 55. To summarize, the equation will now be heart rate is equal to 7.5 times the speed, denoted by x, plus 55. To conclude, Miguel's heart rate will now be 100 BPM, 115 BPM, and 130 BPM respectively.
When doctors prescribe medicines for children, they don't just simply hand out a one-size-fits-for-all dosing. After all, kids are not t-shirts, right? Kidding aside, instead, they use weight-based dosing to make sure the medicine is safe and effective. For example, pediatricians often prescribe amoxicillin, an antibiotic used for infections.
Doctor, how much dosage of amoxicillin should I take?
Oh, what's your weight?
40 kilograms.
Well, since you're a teenager, I'll give you 30 milligrams. And if you use a linear equation, we can simply put y is equals to 30 milligrams, and we multiply that to x. X is your weight, so we substitute it, and 30 milligrams multiplied by 40 kilogram is 1,200 milligrams. This is a linear function because the dosage increases at a constant rate with weight. It's like math and medicine teaming up. Each extra kilogram means exactly 30 milligrams more of medicine. Weight-based dosing is just one way of mathematics quietly saving the day in healthcare.
When doctors prescribe medicines, they don't just guess the amount, especially for something as important as painkillers. The right dose depends on the patient's body weight, making sure the medicine is safe and effective. For example, myself, Dr. Morales, has a patient named, let's call her Anna, who weighs 70 kilograms. The drug information says the dosage should be 5 milligrams for every kilogram of body weight. The formula looks like this. Y equals mx. This is a linear function because the dosage increases at a constant rate with weight. Every extra kilogram means exactly 5 milligrams more medicine. No surprises. Let's compute for our patient Anna. So let's type in here y equals 5 times 70 because Anna weighs 70 kilograms. So 5 times 70 is 350. So patient Anna needs 350 milligrams of the painkiller. And there, that's how you solve it.